Hello everyone, I'm here with Frida Marchena and I'm gonna be interviewing her about her profession. Okay, well, first of all, thank you for agreeing meeting with me and having this interview about your profession. Okay, let's start with the first question. What did you study?
I study physical therapy. I study in Mexicali, UVM, Universidad del Valle de México. Currently, I'm studying my master's degree in neurorehabilitation.
Okay, that's interesting. Okay, first of all, what is exactly what you do? What is your job?
Okay, my job is creating treatment or treating people with different disorders, pathologies, injuries in their bodies, and the treatment is based on physical agents such as ice, cold, water, electricity, ultrasound, and and we create the treatment with our main object object is like improve quality of life of these people. We don't give medication to our patients. It's all with the agents and with our hands and different techniques that we
Use.
yeah.
Okay, you mentioned something really interesting that at least I didn't know. You mentioned that you work with ice and you work with electricity. Like, how do you use these tools with your patient?
Okay, depending the pathology, the injury or the disease that the patient has, you use the best, the agent that most like
Works?
works with them. So in electricity, I refer that we use current, and there are different types of currents. There are some like that has an effect of analgesic, relaxation, for pain reliever. So that's you need to dosificate the current, and that's how they work on the body.
Wow, that's super interesting. And actually, now that you mentioned that, there's like a taboo thought about your profession. Like most of the people, I think the physical therapist is just like massages and fast, like mainly stuff like that. So, what could you tell us about this to break those taboos about what is really physical therapy?
Okay, I think that's a little confusing in that part or area because we work with massage. We use massage is one of the physical agents, I'm telling you, because with the massage you create a lot of benefits in the body, but it's a technique that we use. It's part of the treatment, but it's not the treatment.
Exactly.
No, it's not all. It's part. You can use it like a part to complement, but no all of the treatment.
So, for example, if you have one patient and it requires a massage, you're not gonna be like the whole time doing the massage.
No, we can use like we can use something like heating pad. A heating pad for 15 minutes, then you put the current, then you do the massage, then you do some stretching. It all depends on the pathology and the area you're treating, because are some lessons that require ice or some that require cold. Some injuries you cannot apply a massage.
Okay, sorry for the noise. Okay, so basically you detect what the patient needs and you use these tools to help you to do like their therapy.
We use that. Well, it's the main thing, the agents, but there's a lot of techniques such as kinesio tape, or we have some other tools. Like for the massage, for example, we can use a gun that do the massage, or there's another tool.
Gun?
Yeah, like a gun. You see it?
Gun. Yeah.
Like the gun.
I thought like literally a gun.
Well, it's a massage gun. That is
Yeah,
how
you
it's
need to
called.
specify.
That is how you call it, massage gun.
Oh,
And there's another kind of like the cupping.
okay.
You have guys or you see the cups It's like a little cup that you put on the skin and you suction.
Oh yeah, I've seen that, but like that is for relaxation or it is to.
That's for
something else.
fascia liberation.
Okay,
And,
what is that?
the fascia is like, how can I explain? Okay, you have the skin and you have the muscle,
Uh-huh.
and you have like a layer of tissue that connect the muscle with the skin,
Uh-huh.
and that tissue is called fascia.
Okay.
And when it's inflamed, or when you have a contracture of your muscles, that fascia inflammate and you have to liberate.
Oh, okay.
So that's how we use the cup.
So I've seen like these pictures with people on their back and it has like big like circles and it looks painful, but it is painful or not?
Well, yeah, it's painful. That's why I use it only with my athletes patients, because athletes can tolerate more pain and the and the injuries that they have. It can be treated with that, but for example, to a kid or to an old man, you cannot apply that.
No, I can actually not. Okay, what kind of patients do you work with?
Okay, I work with athletes. I like working with them because the rehabilitation process is really fast and active.
Okay.
And I like to work with orthopedics. That is more with, I don't know, ankle sprains, fractures, post-operate people, like an operation of the knee, elbow, that kind. I really like to work with old people in geriatrics. I love old people, and with them we work like it's prevention of injuries or disease with exercise or stretching, that. And I don't work with kids.
You don't like to?
Well, I like kids, but working with them is a little like hard and it's sad. So
Okay, you don't like to.
yeah.
Okay, and how long do the hour of therapy last?
Okay.
Oh, or it's an hour or 2 hours, or depends on the patient. Like, how do you manage that?
No, actually, most of the time it's 1 hour. The treatment, I prepare like the treatment to last for an hour. Yeah.
Okay, so basically you do all of it in like 1 hour.
Yeah. Sometimes it gets a little more time, or sometimes it's less. But yeah, actually,
Generally, time is 1 hour.
1 hour.
Okay. You recently started a new project, right? What is about this clinic? You could tell me about.
Oh yeah, I recently opened my own clinic.
Congratulations.
Thank you. And I'm working with that patients that I told you, and I have a little project in mind. Recently, I'm going to take a certification about pregnant women, like exercise after and before the pregnancy, in between. So
Sounds interesting.
yeah, and I would like to attend pregnant women.
In the future.
Yeah.
Okay. Okay, I think we covered all the questions. Just one last question about like the taboo area. You do like relaxing massages, or you're not, like that's not what it's about? Because I think a lot of people have that in mind.
Yeah, I know. Well, look, I'm gonna tell you why I can do it, relaxation, but it's not like that our area. Because when you think in a relaxation or relaxed massage, you think, the environment, the candle, the light,
Music.
the music, the light, all that. In a spa, they give you that environment for relaxing. And with us, we can do it because we know how to, but it's not the idea. O sea, I can give you a relaxation massage, but not with that concept. Okay, we are going to use well, the basis, about how your body works and all the benefits a relaxation or relaxing massage have, but not with that environment.
Because that's not like the professional thing, right?
Yeah, that's not our object. No.
Like your objective,
That's not the object.
the main goal. I
The
think
main
it's
goal,
called.
yeah.
Sorry.
Yeah, and because, for example, if I know that you have like super stressed your back muscles, okay, I give you the massage, but I know that maybe you need a stretching or maybe you need to do some exercise.
Yeah.
And I'm gonna tell you that. And in Spanish, they are going to give you the massage and
Everything's okay. Goodbye.
Yeah,
See you next time.
and I'm not saying it's not bad doing that. It's good, but like in the medical area, that's not our objective. That's the difference.
Okay, and last question. How do you manage like having your own project, your patients, like your finances? You do everything or you have somebody to help you with that stuff? With the administrative area.
Yeah, recently I have someone that helped me in that area because I'm like super disorganized.
Sorry for the noise.
Yeah. I'm super like disorganized, yeah. And I have someone to help me with that, but I work on my own, and that person is my mom.
Okay.
But because she's an
Administrative. I think it's called. I don't know if it's called license. Sorry.
Yeah, it's business administration, but I don't know if it's license. But she helped me. She did she's like,
Helps you with administration.
Yeah.
Administrative area.
Yeah, she helped me.
Clinic.
Yeah, and I hope that in some future, if my clinic grow, well, I can have like all the people working with me.
That's amazing.
Yeah.
Well, thank you so much, Frida Marchena, for telling us about your job and your profession. And we can hope that people can learn a little bit more about this and not only staying with the taboo thing about this and actually learn about this physical therapy that is actually really interesting and helps a lot of people. So thank you, and thank you guys for watching.
Thank you for inviting me.